Hello, my name is Carl Cooper, and I'm the Project Manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability, and this is our presentation, Health Insurance Jeopardy, Part 1, Prescription Drugs. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of health insurance Jeopardy! I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. Today we're going to be looking at the category prescription drugs. And in this first scenario, let's assume you meet an individual that has a disability that causes spasms. In this instance, you need to ask the question, does the individual take medication to treat the condition? And let's assume that the individual tells you that yes, they do take a prescription muscle relaxant. If they do, then you need to ask the question, how do you find out what medications are covered by the Qualified Health Plan, or QHP? And in this instance, the answer usually comes on the drug formularies that most of us are familiar with. Let's assume then that the individual takes the prescription muscle relaxant and you're looking at the drug formulary. Then you need to ask the question, does the QHP have a tiered prescription medication benefit? A tiered prescription medication benefit just means that they treat different drugs differently and therefore many times have different co-pays or co-insurances related to it. The most common of these known in drug situations is the generic versus brand name drugs and how the plans treat those differently for co-pays. But there's other tiers as well, including preferred drugs or specialty drugs, and in those instances you need to find out exactly where the person's drug is going to fall in which tier so that you know exactly what copay they're going to end up paying and really make the best decision financially about which plan they should enroll in, as the copays might affect the bottom line of what they end up paying out over the course of the year. Let's assume once again the same individual still takes the prescription muscle relaxant. You've looked at the drug formulary, you've looked for the tier. Now you need to also ask the question whether the QHP requires pre-authorization for the medications. In other words, does the insurance company have to give the okay before the individual goes ahead and puts in the prescription and tries to get that prescription filled? In those instances, it's very important lots of times if someone is getting close to being at the end of their medication, if this is in that process, you really need to be concerned about the continuity of care, and if there's an issue with them needing pre-authorization and maybe having to go to the doctor for that pre-authorization, then there really becomes an issue of whether or not the person really should be enrolling in that kind of a plan, because that continuity of care may get interrupted and therefore may not necessarily be the best plan for that individual. The same individual tells you that he has tried generic drugs before and they were ineffective. In this instance, you need to ask whether the Qualified Health Plan requires a patient to try a generic drug first, commonly known as step therapy. In step therapy, it does exactly that. It requires a patient to try the generic drug before going to the brand name drug. And if the individual has already gone through that, then once again, due to the continuity of care and making sure that the person is staying on the drug that they're on, that might not necessarily be the best plan for them, or see if there's a way that an exception can be made when the individual has already tried that on a prior plan or under a prior situation. If you're interested in finding out more about the NDNRC, you can check out our website, which is www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our YouTube channel to get more helpful videos like this one. And if you're interested in learning about the other categories that were listed, be sure to check out the links in the description below to access those videos. Thank you.